In contrast to cholinesterase inhibitors, which you give to promote muscle contraction, you give neuromuscular blocking agents to inhibit muscle contraction. The therapeutic uses for this category of drugs include promoting muscle relaxation during anesthesia, controlling seizures during electroconvulsive therapy, and suppressing spontaneous respirations and the gag reflex in patients who are intubated and on mechanical ventilation. The prototype drug for neuromuscular blocking agents is succinylcholine, also called anectin. This drug is a depolarizing neuromuscular blocking agent. Pancuronium is a non-depolarizing neuromuscular blocking agent. Neuromuscular blocking agents block the action of acetylcholine at the neuromuscular junction in one of two ways. Depolarizing neuromuscular blocking agents, such as succinylcholine, mimic acetylcholine and bind with the receptor sites, therefore blocking active acetylcholine. This prevents repolarization of muscle tissue and causes paralysis of the muscle during anesthesia. Non-depolarizing neuromuscular blocking agents such as pancuronium compete with and block acetylcholine's access to receptor sites on the motor fiber, preventing muscle contraction. Neuromuscular blocking agents have several side and adverse effects. Patients may experience postoperative muscle pain if succinylcholine is given during the induction of anesthesia, secondary to the contraction of muscles in the neck and upper back that occur during induction. Hyperkalemia is also a side effect of this drug due to its ability to stimulate the release of potassium from tissues. Hypotension may occur secondary to the release of histamine, a vasodilator or ganglionic blockade, which inhibits sympathetic tone of the vascular system. Bradycardia, cardiac, and respiratory arrest are potential adverse effects and occur more frequently with depolarizing neuromuscular blocking agents. The most significant adverse effect of succinylcholine is the risk of malignant hyperthermia. This is a syndrome that can occur during anesthesia as a result of uncontrolled contraction of muscle tissue, which causes a significant and dangerous rise in body temperature. If you don't treat malignant hyperthermia quickly, there is a high risk for a fatal outcome. For patients receiving a neuromuscular blocking agent, closely monitor their potassium levels. Take their blood pressure regularly and continuously monitor their cardiac and respiratory status. Make sure you have the equipment you need for resuscitation quickly and readily available. Monitor patients who undergo anesthesia and make note if they report neck and upper back pain. Watch for patients that exhibit extremely low blood pressure in case they need an antihistamine to block the release of additional histamine. Check the safety alert to learn what interventions you need to take if malignant hyperthermia occurs in the surgical setting.
Safety alert. When giving succinylcholine, be sure to have dantrolene available to give intravenously if patients begin to exhibit signs of malignant hyperthermia. Signs include extremely high body temperature above 40.5 degrees Celsius, also 105 degrees Fahrenheit, and as high as 43 degrees Celsius, which is 109.4 degrees Fahrenheit. If this happens, immediately discontinue the succinylcholine and administer the dantrolene, which reverses the effects of succinylcholine.
Administration of neuromuscular blocking agents is intravenous. For short procedures, give the dose in one injection based on your patient's weight. For prolonged paralysis, such as during mechanical ventilation, titrate the drug by infusion rate according to the level of paralysis desired. If patients exhibit extremely low blood pressure, give an antihistamine to block the release of additional histamine. For the patients who undergo anesthesia and report neck and upper back pain, administer a mild analgesic as prescribed for comfort. Patients taking a neuromuscular blocking agent as part of their treatment need information about the effects of these drugs. Explain to patients who are post-operative that they can expect muscle pain and that it resolves quickly. Tell them you can give a mild analgesic for comfort. If you give a patient receiving mechanical ventilation a neuromuscular blocking agent, explain that the paralysis is temporary and due to the drug. Contraindications for neuromuscular blocking agents include patients at risk for hyperkalemia, especially those who have major burns or trauma. Use neuromuscular blocking agents cautiously with patients who have an electrolyte imbalance. Patients experiencing respiratory depression are at risk for respiratory arrest if they take a neuromuscular blocking agent. Check the safety alert to learn why it's so important to be cautious when giving neuromuscular blocking agents to patients with myasthenia gravis.
Safety alert. Patients who have myasthenia gravis generally have impairment in the use of acetylcholine for proper muscle function. Do not give these patients a neuromuscular blocking agent unless full cardiopulmonary support is available.
Several important drug interactions can occur with neuromuscular blocking agents. Cholinesterase inhibitors decrease the effects of non-depolarizing neuromuscular blocking agents. They also lengthen the time that acetylcholine is bound to receptor sites and actively competing with non-depolarizing neuromuscular blocking agents. However, cholinesterase inhibitors actually enhance the effects of depolarizing neuromuscular blocking agents. This occurs because cholinesterase inhibitors decrease the activity of pseudocholinesterase, an enzyme that inactivates succinylcholine, delaying its inactivation. For an overview of the neuromuscular blocking agent prototype drug, click the button to access a drug information table.